Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what works, and what's backed by evidence. I'm your host, Dr. AK. Let's get started. Hey everyone, welcome back. Today we're going to talk about the difference between chronologic and physiologic age. We all know there is a difference between the two, and we've seen it, right? Everyone knows that 70-year-old who's out there running a marathon versus another 70-year-old who's having a really hard time getting out of a chair, or someone who's in the latter decades of their life who is sharp as a tack versus someone else who's the same age and is having a really hard time with cognition. So why is that the case? Why is there this big gap between our physiologic and chronologic age? What are the things that we can look at to determine that? And more importantly, what are the things that we can actually do to make sure that we are making the best choices for our health so that we can achieve that ideal physiologic age, even in those upper decades of our chronologic age? Let's start with some definitions. Chronologic age is easy. It's the number of years that you have been alive. And everybody ages at the same rate chronologically. It's useful for administrative and legal purposes, but there are some ties when it comes to your health. We know that certain ages are associated with higher or lower risks for disease states, right? Like if I'm in the emergency department and somebody who has no risk factors, no family history, no nothing, is 20 years old and coming in with chest pain, there is a much, much lower chance that it's due to a cardiac reason, like a heart attack, as opposed to someone who's in their 70s. Just based on age alone, oftentimes our risk factors for diseases go up. Another example is influenza. The really, really young and really, really old are at risk for complications from influenza, as opposed to the people who are in the middle decades of their life. For most strains, there's a couple strains where that changes, but for most cases, we can associate the risks of certain disease states with chronologic age. Physiologic age, on the other hand, gives us an idea of how your organ systems are functioning. It represents how well your cardiovascular system is working. What does your metabolic health look like? What's your cognition like? How are your muscles and how strong are they? Is your body able to move? These are the things that we look at for physiologic age. Unlike chronologic age, people do not age physiologically at the same rate. And there are certain biological markers that we can look at to determine that physiologic age. And even better, if we notice that physiologically we are aging in a rapid way, we can actually do some things to affect that positively and make changes. What exactly are the clinical markers that we're looking at that reveal physiologic age? There is an extensive list of evidence-based biomarkers that we can look at that give us some insight on our physiologic age. The first one is our cardiovascular fitness. It is one of the strongest predictors of health and mortality. In a cohort study of over 120,000 individuals, higher cardiorespiratory fitness was associated with a lower all-cause mortality across all age groups, independent of chronologic age. And this is often measured as either VO2 max or zone 2 output. These both reflect the integrated function of the heart, the lungs, the muscles, the blood, the mitochondria. It is one of the clearest indicators of physiologic health. A very highly fit 60-year-old may have a much lower mortality rate than an extremely unfit 40-year-old. When it comes to our metabolic health and biological aging, we're looking at fasting insulin, fasting glucose, hemoglobin A1C, apolipoprotein B, triglycerides. We know that the higher that these markers are, the faster the physiologic aging and increased cardiometabolic risk. We know that insulin resistance and metabolic dysfunction accelerates vascular damage, inflammation, and organ function. And this happens long before overt disease develops. These markers often silently get worse over a course of many years. And it's after that accumulation of exposure to risk that the disease state develops. Individuals who develop cardiovascular disease have unfavorable metabolic profiles like 15 to 20 years before they have that cardiac event. So following these markers and their trajectory can often give us some insight on what our physiologic age rate is. And improving metabolic health can change the trajectory of that physiologic aging. Inflammation is also a marker of aging. In fact, it's called inflammaging was the term that was coined in a paper. But this one's a little bit difficult because inflammation is also very nonspecific. Inflammation can occur with stress. It can occur with illness. It can occur with aging, and it does occur with aging. But the problem is the markers that we use are pretty nonspecific. So things like CRP and interleukin, there's a number of different conditions that can make them go up. So while that is a biomarker that we can use, it's not quite reliable as things like insulin resistance and the VO2 max. But it's still there, and it's still worth discussing because it does give us some insights on our aging. My opinion is when it comes to inflammatory markers, the absolute number usually is not that helpful because depending on what's going on, it can be high or elevated. But the trend is very meaningful. So watching these over time can give us better insight to that physiologic aging process. Body composition and function also give us a lot of insight in terms of physiologic aging. I know, I'm a broken record, I can't help it, but muscle mass and strength really matter. We know that as we age, the higher our muscle mass and the better our strength, the better our health span. And so we can use body composition, things like muscle mass versus visceral fat versus amount of adiposity, to figure out what is that rate of aging that's occurring. Someone who is 70 and exercising and has a lot of muscle mass versus someone who's 70 and has sarcopenia, that sarcopenic person physiologically is way, way, way older than the very fit 70-year-old who still has muscle mass. The other thing about muscle mass, it's not just for strength and mobility. We know that muscle mass can actually be protective from a metabolic aspect. There was a study that was done that showed for every 10% increase in skeletal muscle index, which is something that looks at your skeletal muscle mass relative to your age and body weight, there was an 11% reduction in insulin resistance and 12% reduction in the incidence of prediabetes. So again, muscle mass is important, and it's more than just sarcopenia. Metabolically, it's really important as we get older. Other simple measurements like functional tests, grip strength, stability, balance, flexibility, those also give insight on where you are in terms of your physiologic age compared to your chronologic age. One of the main reasons why I wanted to talk about this is because there are these commercial-grade epigenetic clocks that you can now find on the market. What they use is a measure of DNA methylation. And we've talked about this when we got into the whole epigenetics versus genetics and the biology of aging. DNA methylation is a chemical modification that affects gene expression without actually changing the gene. You're not changing the DNA, but it does influence that gene expression. And I invite you to go back to the prior blog or podcast where we talked about genetics versus epigenetics to deep dive on that DNA methylation again. Briefly, we know that DNA methylation changes as we age. It tends to increase. This concept of DNA methylation increasing with aging has been used to develop epigenetic clocks for the research setting. So you have the Horvath clock and the Grimm age. Both of these are epigenetic clocks with demonstrated associations with mortality and physiologic age. But it's for the research setting. What is happening is there are commercial wellness companies that are hopping on this whole DNA methylation bandwagon and trying to get you to pay anywhere from $150 to about $500 to do these tests, and then they give you your physiologic age. But they are not accurate. First of all, there is a lack of clinical standardization. Different epigenetic clocks are using different algorithms to come up with that physiologic age. There's no universally accepted standard, and oftentimes you will get a different physiologic age output depending on which company you did the test through. Next, there's limited evidence that changing the number actually improves outcomes. And by that, I mean lowering your age on a commercial epigenetic clock is not linked with decreased mortality or improved health span. That association has not been made. There's also high variability and a lot of measurement noise. So I talked about different companies will use different algorithms, but they also have different equipment. There's technical variability, laboratory differences, and the one thing that none of them account for is that short-term biological variation. Like your DNA methylation today might be different than your DNA methylation in a week from now, and it has nothing to do with aging. So this really limits using these clocks in any kind of capacity that would result in a decision for something. And lastly, they don't really add any information to the picture. What if your physiologic age on an epigenetic clock is older than your chronologic age? What does that mean to you? How do you know what to change? What are you going to do that's different? That doesn't mean like all of a sudden you go eat healthy and then that number on that commercial epigenetic clock is going to get better. There's no data to support that this number on this epigenetic clock means anything. And so clinically, we have no idea what to do with the information. Now, there are some online wellness companies that do a whole smattering of testing. They get a whole bunch of blood tests, some which have some meaning, some which probably do not. And they put that all together, and based on that, they'll give you a physiologic age. Maybe that's a little bit helpful because it does look at some of those biomarkers that I talked about, especially when it comes to metabolic health, right? Like the insulin resistance or some of your lipid panel. But what it doesn't do is account for your functional status. Some of these companies will talk to a device, like if you have an Apple Watch or a Fitbit or something like that. So they'll pull in an estimated VO2 max and an HRV and give you a little bit more information. But what none of them do is test your strength. They don't test your balance. They don't test your stability. Nobody's testing your cognition. And so it doesn't give you that complete picture. It's not completely reliable. And I'm not saying don't do it. If you have the means and you can afford it and you want to do it, go ahead. Some people really like data and they find it interesting. All I'm saying is it's an incomplete picture. You shouldn't see this thing and it's like, oh, wow, look, I'm 10 years younger physiologically than my chronologic age. If you're not looking at all of the data and you're not getting the whole picture, that might not be accurate. And I don't know that I would put a whole lot of solace into it. It's still fine. You can still do it. I mean, your lipids are important to know. If you're not seeing a doctor regularly and you don't know what yours are, sure, go ahead, get one of those tests. But just be cautious with how you interpret the results and what decisions you make based off of those results. I'm all about getting data that you can do something about, right? Like if I measure my VO2 max now, I can get a pretty good idea of what the trajectory of my VO2 max is going to be like in 20 years from now if I do nothing. But I can modify that. I can do interval training. If I want to improve my zone 2, I know what to do with that. If I have evidence of insulin resistance, there's all kinds of things that I can do to change that. So I like data that has some kind of clinical, actionable outcome as opposed to just you get some number and you're supposed to do something with that. When we look at it that way, physiologic markers are not just predictors of health. They actually give you targets for intervention. When we're measuring the right markers, we know how to improve our cardiovascular health, metabolic health, how to improve our muscle mass. These are things that we can do to make changes. I think those epigenetic clocks are really promising research tools, but we are way, way, way too far from using them in primetime commercial testing. We're just not there yet. The goal is not to change a number on a report. The goal is to make the changes and modifications that you need physiologically to your body that help keep you alive and healthy. I hope you found this discussion worthwhile, and I will talk to you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, the Whole Human Health and Well-Being. Take care, and I'll talk to you next week.